our supply increases, so will your ability to schedule an appointment. And we've, our estimates earlier this morning, we looked at this, and about 39% of eligible Hoosiers have been vaccinated or made an appointment, I guess I should say, to be vaccinated. So first dose, full dose, or made an appointment to be vaccinated, 39%. So we're about at 40%, got a long way to go. Fortunately, the supply is there, and more good news is, along with and only because of our federal partners, we've announced that we're going to have an 8-week mass vaccination site in Gary, Indiana, which not only enables us to get out, 2,000 doses per day for an 8-week, 7 days a week period, real sustained effort. But that's also going to, as you described, alleviate and we will be able to send mobile units out throughout northern Indiana.
With another 1,000 doses.
With another 1,000. So with the 500 sites that we already have around the state of Indiana. So it's a big deal to have that mass vaccination site in Lake County and Gary, Indiana, like we've had in Marion County as well, and others. But to have that for that 8-week period, it's a big deal. And then to be able to send the mobile units out. But again, the docs will have more on that. We also have, I'll be quick about this, we also have Fred Payne with us. I mentioned last week we'd get an update on our unemployment claims and all he's doing to prevent cyber attacks and fraud and how all these things work together. So with that, I'll turn it over to Dr. Box for our weekly update.
Thank you, Governor. Good afternoon, Hoosiers. Today is the day we've all been waiting for, the day that any Hoosier age 16 and older can schedule a COVID-19 vaccination appointment. This means that any Hoosier who falls within the age groups for which the vaccine has been authorized now has the opportunity to be vaccinated against this disease. As of this morning, approximately 5.4 million Hoosiers can now sign up for a vaccine. Millions of Hoosiers have already done so. Just today, we saw 21,000 appointments scheduled in the first 30 minutes of expanded eligibility, and 96,000 people had made appointments as of noon. This milestone also means that age is now the only eligibility requirement to receive a vaccine in Indiana. We also have removed the language requiring proof of residency. We have made this change for several reasons: to comply with requirements at the FEMA site. We also know that some individuals may live in a household with multiple individuals but lack a document that shows an Indiana address. And students at colleges and universities, or even some people in Indiana workplaces, may live out of state but spend a significant amount of time in Indiana. We want to remove any barrier. If you are age 16 or 17, you can only receive the Pfizer vaccine, and we ask that you bring a parent or guardian to your appointment if at all possible. If you cannot, most locations will accept a written consent or a verbal consent by phone. Individuals age 18 and older can sign up at any site by visiting rshot.in.gov, by calling 211, or by going to one of the federal pharmacy partner sites like Kroger and Meijer. Individuals signing up through rshot.in.gov will find more than 530 locations that are offering vaccine. Those appointments are spread out over many weeks to ensure that enough vaccine is available to accommodate the appointments. You will find special sites like the mass vaccination clinics at the Indianapolis Motor Speedway, which opens tomorrow, and the 8-week clinic that will be held in partnership with FEMA at Gary Roosevelt's Park beginning next Wednesday. You will also find appointments or extra clinics being added at existing vaccination sites, such as our local health departments, community clinics, and hospitals. Partnerships have been a hallmark of the pandemic response, and the vaccine rollout is no exception. An incredible amount of work has been done by partners at the local, state, and federal levels to get to this point, and it doesn't come a day too soon. We have said before that we are in a race between the vaccine and the variants. Unfortunately, right now, the variants are picking up steam. Indiana has now reported 137 cases of the UK B.1.1.7 variant, 2 cases of the B.1351 variant out of South Africa, 1 case of the P1 variant out of Brazil, and 27 cases of the California variant. Our proximity to Michigan, which is one of the top states for B.1.1.7 variants, is also a concern. I say this to remind Hoosiers that COVID is still very much present in our state and encourage everyone who is eligible to sign up for a vaccine as soon as possible and to continue to wear a mask and take precautions. If you're looking to visit the iconic Indianapolis Motor Speedway for your vaccination, know that the clinic is filling quickly, but that appointments remain for the week of April 18th and the final week of April 24th through the 30th. And I think actually only the 24th through the 30th is open at this point. If you live in northwestern Indiana and want to come to the mass vaccination clinic, that will be open next Wednesday in Gary, and we'll be opening those appointments by the end of the week. You will be able to sign up at ourshot.in.gov at that time. The Gary Clinic can provide 2,000 vaccinations a day. It will offer the first dose of Pfizer for the first 3 weeks and the second dose of Pfizer for the second 3 weeks, and then Johnson & Johnson for the final 2 weeks. It will be held in a drive-through format, but will also have opportunities for individuals who travel by bus or other modes of transportation so that there is a walk-up option. In addition, as a supplement to the Gary site, we will have 2 mobile units that will host clinics in 9 counties across northern Indiana in the coming weeks to help ensure that the vulnerable communities have easy access to the vaccine. These clinics will be able to administer 1,000 doses a day and will follow us to further reach underserved populations, will allow us, This week, we also launched a Spanish line through 211 so that our Spanish-speaking Hoosiers have easier access to information and help with registration. Callers to the 211 select the appropriate prompt that will direct them to a team of Spanish speakers. On the first day, the team answered nearly 400 calls and scheduled more than 180 appointments. And our Zotec registration system is now available in Spanish, and we're adding Burmese soon. As we increase our vaccination and outreach efforts, we are also working with our partners at the Regenstrief Institute to better identify breakthrough cases. Breakthrough cases occur when an individual tests positive for COVID-19 at least 14 days or more after receiving their full vaccination. That means the person has received either 2 doses of Moderna or Pfizer or a single dose of the Johnson & Johnson vaccine. We identify these cases by matching data on our vaccination to our vaccination data. So anybody who tests positive, we match it with the vaccination data. We have identified 221 breakthrough cases as of March 16th. These cases represent less than 0.04% of individuals who were fully immunized as of March 16th. More than 21% occurred in individuals age 80 and older. We will continue to work with Regenstrief to track breakthrough cases to review the symptoms, the diagnosis, and the hospital stays. We will also begin testing samples from these cases to determine if they were caused by variants. This will help us to better understand the vaccine's effectiveness against variants and inform our strategies going forward. As we've done throughout the pandemic, we remain laser focused on the data we receive. Nearly 2.8 million doses have been administered. That includes more than 1.7 million first doses of Pfizer or Moderna and nearly 61,000 doses of the Johnson & Johnson vaccine. More than 1.1 million Hoosiers are now fully vaccinated, up from just over 1 million last week. This means that more than 21% of Hoosiers for whom the vaccine is authorized have received either 2 doses of Pfizer or Moderna vaccine or a single dose of the Johnson & Johnson vaccine. When we look at vaccine uptake by age, we find that nearly 74% of Hoosiers age 80 plus have scheduled or received a vaccine. 77% of those 70 to 79 have done so. 66% of those 60 to 69 are getting vaccinated, and 48% of those ages 50 to 59 are in line or have gotten their first dose. 35% of those ages 40 to 49 have signed up. We also have seen 25% of people aged 30 and older sign up. Almost 10% of Hoosiers aged 20 to 29 have already signed up. We know that more than 24,000 Hoosiers ages 16 to 19 have also scheduled a vaccination. These numbers also include more than 152,000 first and second doses administered to residents and staff in long-term care. Those numbers are encouraging, but we must remain cautious as our positivity rate has ticked up slightly. It now stands at 3.9%, up from 3.3% last week. We also have seen a slight increase in the number of Hoosiers hospitalized. The number of Hoosiers currently hospitalized with symptoms of COVID has crept back up to 657 as of yesterday. While this is still far better than the nearly 3,500 hospitalizations we saw just a few months ago, it is something we will continue to monitor closely. Daily hospital admissions for COVID remain at some of our lowest levels in months, but they too have increased slightly to just over 60 per day. Our color-coded county maps still look much better than they did a few weeks ago, but they've shifted slightly. The number of counties in blue on our 2-metric map has dropped to 53, down from 66 last week. 2 counties are in orange, and the remainder are in yellow. Our advisory map has also shifted this week. This week, we have 2 counties in orange, up from just 1 last week. 48 counties are in blue, which is down from 57 last week. The remainder are in yellow. These metrics tell us that cases are increasing in parts of the state, which again serves as a reminder that we cannot throw caution to the wind and behave as if the pandemic is over. We want the pendulum to swing back in a positive direction so that we can prevent hospitalizations and save lives. Today, we reported 1 new death, which brings our total lives lost to 13,039 when you include both confirmed and clinically diagnosed deaths. The best way to prevent further loss of life in this pandemic are to follow the mitigation measures we've discussed for over this past year and to get vaccinated as soon as you are able to do so. This layered approach is truly our best path forward. And now Dr. Weaver has some more updates on our vaccination efforts.
Thank you, Dr. Box. We are embarking upon one of the most exciting times in our pandemic response over the next week, and we hope to see Hoosiers turn out in droves to get their vaccine. We were notified yesterday that we can expect more than 405,000 first and second doses of vaccine this week. That includes 88,920 first doses of Pfizer, 66,900 first doses of Moderna, which is an increase of about 2,000 from last week, and 96,500 doses of Johnson & Johnson. These supplies are critical to our efforts to get shots in the arms of every Hoosier who wants a vaccination as quickly as possible. In addition to the mass vaccination clinic starting tomorrow at IMS and next Wednesday in Gary, we are working to get vaccine to large businesses and institutes of higher education in very short order. Our business and industry efforts are focused initially on those businesses that have 1,000 employees or more. Approximately a dozen businesses are in the process of launching vaccine clinics at this time. The majority of these companies have in-house or third-party health partners who administer the vaccinations to their employees, and the sites will receive primarily Pfizer vaccine. This week, we were able to allocate 24,000 doses to distribute to those businesses. Multiple other organizations are in the process of finalizing their plans, and we expect to allocate another 6,000 doses for those entities this week. Last week, we also sent a survey to colleges and universities to gauge their willingness to receive vaccine to administer to their students and staff. Our goal is to provide at least the first dose of vaccine to the students before they leave campuses for the semester. We will be allocating 60,000 doses of Pfizer for this purpose. 6 campuses are planning to begin vaccinations next week, and those are IU Bloomington, Purdue, IUPUI, Notre Dame, Butler, and Goshen College. 3 other campuses are in the process of finalizing their plans, and we have heard from at least 6 others that are partnering with their local health systems in order to vaccinate their students and staff. While we might not be able to provide both doses to students before they leave campus, every student who receives a vaccination will get their card so that they can then use it to schedule the vaccine in their home community or state. This will help protect not just Hoosiers, but individuals in other states from COVID-19. Pharmacies participating in the federal program are receiving more doses of vaccine. Currently, 125 Walmart locations are participating in the program. You can register for appointments at those sites through ourshot.in.gov. In addition, 113 Kroger locations, 39 Myers, and 23 independent pharmacies are participating in the federal program. This brings the total to 326 number of pharmacies providing COVID-19 vaccinations to Hoosiers around the state. As more vaccine arrives, our team will be working on plans to get it to more locations so that it can be conveniently located to Hoosiers in all corners of the state. Currently, 88% of the population is within 5-mile radius of a vaccine clinic. Additionally, the Homebound Hoosier program has vaccinated 754 individuals, and we are getting vaccines to more every day. Finally, I wanted to reiterate what Dr. Bach said. We are very excited to extend eligibility to young Hoosiers today whose lives have been upended, just as ours have. Missed proms, virtual school, sports and events without all of your family and friends in the stands is not the high school or college experience you imagined. Well, now, 16 and up, it is your shot. Because 16 and 17-year-olds can only receive the Pfizer vaccine, we have updated our map at ourshot.in.gov to provide color coding that shows which type of vaccine is available. If you are looking for Pfizer, search for sites marked in yellow. You can also easily see sites that have Johnson & Johnson or Moderna, as well as those that offer multiple types of vaccine. We have also heard great news coming from Pfizer that their clinical trials of 12 to 15-year-olds have found the vaccine to be 100% effective in preventing COVID-19 and was very well tolerated in those populations. Pfizer reported that it expects to seek emergency use authorization from the FDA for these populations soon. So our hope is that we will have yet another age group that will be eligible to be vaccinated by this summer. In the meantime, the most important thing that we can all do to protect our children who cannot yet get vaccinated is to get vaccinated ourselves. We are extremely appreciative of those partners who have been working all hours for the past 3 months to get vaccines in arms as quickly, efficiently, and safely. There are a lot of amazing things that these partners are doing across the state to get the vaccines in arms. Hospitals, local health departments, and FQHCs, in addition to the normal vaccine clinics, are doing specific outreach and dedicated clinics for at-risk, vulnerable, and vaccine-hesitant communities. And to all of our other partners, community leaders, Zotec, Lilly, local health officers and their teams, those working at all the vaccine sites, all of the volunteers, the hospitals, and the Vaccine Advisory Committee. The list is too long to name you all, but thank you. And to all of you for everything that you've done, reaching out with words of encouragement, and for all of you who are doing things that you can to protect yourself and others. Thank you.
Thank you, Lindsay. And Fred, you want to give us an update on all the progress you've made to date? It's been a long haul, but to date in terms of claims and fraud prevention and those cyber attacks that I alluded to earlier?
Yes, Governor. So it was about this time last year that we saw the highest number of initial unemployment claims filed in recent Indiana history, at 139,000 in 1 week. At the beginning of this month, for the week ending March 6th, we saw about 9,200 initial claims filed, which marks the lowest since the pandemic started. Now that number has fluctuated since then, and we anticipate it to trend down. This is confirmation that we are headed in the right direction. Now there have been a lot of changes and challenges since this time last year, including the creation of several federal programs that have helped Hoosiers financially. Now while we've ensured that the vast majority, 85% of claims are processed within and paid within 21 days, nuances and significant reasons for the remaining 15% to have continued investigations exist. Now, before I go any further, I want to correct something that I hear often. Claims are not people. Claims are what people file each week to request unemployment insurance benefits. People are claimants in this system. I've often heard people use claims interchangeably with people. This can be confusing, especially when referring to the numbers of claims processed. For example, a person, a claimant, could have filed more than 25 claims to cover 25 weeks of unemployment benefits. Now, to put this in context, we received approximately 18.4 million weekly claims filed by claimants between March 2020 through February 2021. Of those claims, 86% have been processed as paid or denied. Now, through the middle part of last month, 15.8 million weekly vouchers claims have been resolved since March 2020. 2.5 million are unresolved, of which 2.3 million are being investigated as suspicious. which is 89% of all outstanding claims. Now, throughout the pandemic, more than 850,000 Hoosiers have been paid unemployment insurance benefits. By comparison, in 2019, over 82,000 Hoosiers were paid unemployment insurance benefits. Now, I'll share a few real-life examples of the more challenging claims processing that go beyond 21 days. Now, to protect the privacy of claimants, no names will be used and other potential identifying information has been changed. One big issue that causes continued processing, that's called a job attachment issue. A job attachment issue occurs when the information we have does not clearly indicate that a claimant has been properly employed to make him or her eligible for benefits. Here's an example of a job attachment claim that went beyond 3 months. In December, a claimant filed a PUA claim and requested benefits retroactively back to May. The date indicated his business was impacted due to COVID in May. Because the person made a request for payment of benefits several months after he was reportedly impacted, this immediately created about 24 dated claims for the person that needed to be investigated. Here's what the continued investigation uncovered. The claimant stated that their business that was closed was a hairstylist at home. The claimant stated that the home address was in another state. There were 2 phone numbers associated with the account from another state. There are 2 phone numbers. Those 2 phone numbers were inactive. There was no history of Indiana wages reported, and claimant had no Indiana driver's license or history of tax returns. Our claims investigators investigated and called the phone numbers that were inactive, and we sent emails and deadlines to provide information. Now, another example, we received calls and inquiries from and about a claimant with similar characteristics, but a different job, that she had filed for benefits in March and had not received any benefits from our agency. The investigation revealed that the person had, in fact, filed for benefits, but did so in December and requested retroactive benefits back to March. A further investigation revealed similar characteristics as the claimant before. Now, these are examples of matters that take an extreme amount of time for investigators to process, even if the process leads to a non-payment, overpayment, or payment if eligibility is deemed. Now, I'll give you one additional example of where a claimant was actually frustrated with the time that it took to use one of our required tools that we put in place to stop fraud. The person filed a claim in 2020 and was being paid weekly benefits. Because of the new verification requirements from the U.S. Department of Labor on PUA claims, the person was asked to update and verify identity information through ID.me, the vendor we're using to help verify a claimant's identity. The claimant ran into issues because she had multiple attempts with the online self-service process. Now, this could have been because there were too many login attempts that threw up red flags in our system, which then required the person to go through another process to have an actual person to assist. Unfortunately, during the time this claimant was moving through the process, there were long wait times with our vendor ID.me, and the person did not get through the process quickly. She was delayed. The person's issue was resolved and benefits resumed. However, this is an example of our system not working as we desire it to work or working as quickly as we want it to in certain situations. Now, we continue to work with our vendor on this issue. Now, these are just small examples of claims working their way through processing that may take longer than 21 days. These are also examples of how resources may be tied up on chasing claims that may be fraudulent, which impacts the processing time for legitimate claimants filing for benefits they are truly owed. Now, I want to take a few moments to talk a little bit about fraud. Now, fraud has become a dominant factor in our unemployment insurance system, and it does impact processing time. As an example of the magnitude and the sophistication coming from the fraudsters, consider the following. From March 16th through March 30th of this year, Uplink, our unemployment